Hello, future medical administrative specialists and medical billing specialists. It's your instructor, Kathy Spahn. Thanks for joining me for this presentation to introduce you to the CPT coding book. Note this is not intended to replace reading Chapter 5 of the textbook, as I will not cover all the information found in the chapter. Be sure to read the chapter and make note of all the great illustrations, figures, and tables provided throughout the textbook chapter reading. Last week we learned about CPT 10 diagnosis coding, right? We talked about assigning codes to diagnoses of our patients. This week we're going to concentrate on CPT coding. The abbreviation CPT stands for Current Procedural Terminology. CPT coding is assigning numeric codes to the procedures and services that took place while the patient was seen. Examples include tests, surgeries, and evaluations. Whatever services a provider would like to get paid for requires a code. Claim forms must include at least one CPT code and at least one ICD-10 diagnostic code. And the combination of these codes must make sense. This is called code linkage. Again, through the Madison College's textbook rental program, each student should have the CPT Professional Coding Manual in their possession. As a reminder, please do not write in these coding books. Instead, I suggest using scratch paper, post-it notes, and/or flags if necessary as you assign codes using the rental books. Please grab your CPT Professional Coding Manual and let's get acquainted with this book and coding set. Page through your CPT manual with me to get familiar with this book. We'll quickly flip through it and then go into a little more depth for some of the major sections. After opening the book, we first come across a place of service codes for professional claims reference. Each insurance claim must always include a place of service code, which documents where the procedure or service took place. Take a look at the first column of this table and note the different places where healthcare services might be performed. For example, if a patient goes to an urgent care facility, the place of service code noted on the claim form would be 20. Take a second and locate this example. Note the description for the place. For the purpose of this class, most examples refer to an outpatient clinic office setting. Therefore, the place of service code typically noted for this class will be code 11 office. Turning the page, you will note information about the CPT as well as all the people and committees who keep the manual up to date. The CPT code set is proprietary information belonging to the American Medical Association, or AMA. Online references for CPT codes are not easily found unless a subscription has been paid to access the AMA's online services. The table of contents is next, followed by some more introductory information. You might find reading some of this information informative and useful. Next, there are pages called a list of illustrations. Refer to the guide words at the top of the page to confirm the pages you're looking at. This is pretty self-explanatory. As you page through the actual main text of the book, you'll see lots of medical illustrations. These are referenced in the procedural illustrations pages of the list of illustrations section. Next, we find some very useful evaluation and management tables, the color-coded main text where the codes are found, some appendices, and the index. Let's look at those sections in a little bit more detail, starting with the index, the last color-coded section of the book, way at the end. Take a minute and find where the index begins. Use the color-coded sidebar of the pages to find the index. Again, this is the last section of the CPT coding book. So I've asked you to please turn to the back of the CPT book to the last color-coded set of pages. You will see the word index on the colored sidebar. The reason why we will check this out first is because this is where assigning CPT codes to services begin. Similar to the ICD-10 alphabetic index section, the CPT index is arranged in alphabetical order by main term. These terms can be listed by the name of the procedure or service, such as echocardiography, by organ or anatomical site, such as fibula, by condition, such as glaucoma, and by synonyms, eponyms, and abbreviations. Synonyms are alternate or replacement words, such as disease and syndrome, The two words could be used interchangeably. If the medical coder does not find a term under one entry, a synonym might be tried. In last week's presentation, I defined that an eponym is a word derived from someone notable in medicine, typically someone who discovered something. There are a lot of eponym examples, such as mustard procedure. MayoClinic.com describes this as a procedure to transpose the great arteries of the heart, usually in babies. The procedure was named after William Mustard. Finally, some terms may be found by well-known abbreviations such as MRI, HDL, or GERD, G-E-R-D. Take a second and look up the abbreviation GERD, G-E-R-D, in the index section. Pause the video if necessary and start it again when you have found it. Note that many abbreviations are cross-referenced to the full term. In this case, the entry under GERD, G-E-R-D, shows C, gastroesophageal reflux test. The coder would then look up gastroesophageal in the index as the next step. Looking at the index, you will note CPT codes contain 5 numeric characters. Many entries in the index show a range of 5-digit possible codes. After locating the main term in the index, the coder must next refer to the main text of the CPT book, find the possible 5-digit code or range of codes, and read the information to locate the correct code for the procedure or service. We'll practice this together in a few minutes. But first, let's take a look at the main text, the other color-coded sections. For the purpose of our class, we are going to concentrate on Category 1 codes. Students may read about Category 2 and 3 codes in the textbook. Category 1 codes are found in the sections noted in the table on this slide. Flip through the different sections as I give a quick introduction to each. Again, this information is found in the textbook reading for Chapter 5. The first section of the main text is entitled Evaluation and Management and contains codes for determining the best course of action for a patient, such as office visits, hospital visits, and consultations. This section has been placed first as it is very widely used. We'll go back to this section in a minute. The next section of the CPT main text contains codes for anesthesia and is arranged by body site. Page through this section. Do you see the main bold term shown by the site of the body? Following the anesthesia section, you will find the surgery section. This is organized by body system, then by body site, and then by the procedure group. Note the surgery section is the largest section of the CPT main text and is further subdivided with different colored sidebars by body system. Use the guide words at the top of the pages to note which section and system you are looking at, such as surgery/cardiovascular system. Many surgeries are coded as a surgical package, which includes preoperative visits, anesthesia, the procedure, and postoperative care, all in one code. Please read the textbook for further information regarding surgical package coding. The radiology section follows the surgery section and is arranged by the type of procedure and then by body site. Radiology services require 2 codes. One for the technical component, which includes the technician, equipment, processing, etc., used to capture the radiograph, and the second code for the professional component, which includes the radiologist's reading, interpreting, and writing documentation of the radiology procedure. Pathology and laboratory is arranged by the type of procedure. Finally, the last section of the main text is the medicine section, which includes codes for evaluation, therapeutic, and diagnostic procedures that physicians perform. Now that we've had a quick tour of the CPT manual, let's walk through assigning a CPT code together. Here's our example of a service which would be documented in the medical record: excision of a cyst, left breast. What's our first step once we have found a procedure or service to code? Right, we look it up in the index in the back of the CPT manual. So what should we look up? This could be found in a few places in the index. Pause the video and give it a try, then resume the video. The possible code is found under breast, cyst, and excision/cyst. Did you find the code that's possible? The possible code is 19120, right? Jot it down on a piece of paper, because again, we're not going to highlight or mark in the book. Okay, now we're going to look this up in the main index of the CPT manual. Use the colored sidebars of the pages to navigate to code number 19120 and read the description. CPT code 19120 is correct for an excision of a cyst in a breast. This code would be noted on a claim form. Here's another example. Loose body of the right knee. What should we look up in the index? Stop the video and try a few things, then resume it when you're ready. I found it under loose body and knee/removal. Again, codes may be found in several places, or the coder may need to consider the anatomy and medical language further to uncover where to begin with coding. Code 27331 shows as a possible code. Now let's look this up in the main index, again using the numbers shown on the color-coded sidebars or the guide numbers at the top of the pages to navigate to 27331. 27331 is the correct code for removal of loose body in the knee. Let's take a few minutes to discuss the evaluation and management section of the CPT manual, as it is unique from the other sections. Let's turn to the evaluation and management section, as there are some specific considerations for determining the correct code for these types of services. Remember, evaluation and management codes are found at the beginning of the main text of the CPT and starts with page 1. This section has been moved to the front because it is so widely used and referenced. The CPT main text is mostly arranged in numeric order. However, codes in the evaluation and management section start with 99201. Note this on the color-coded sidebar of the section. So that is why the first codes start in the 9900s, and then the anesthesia codes begin with 00100. The beginning pages of the evaluation and management section provide a good overview of the different codes and things to consider when assigning a code from this section. If a patient visits an office or outpatient or ambulatory facility, a code and corresponding fee is included just for the visit. Evaluation and management codes capture specific information about the visit, such as the type of visit, which could be an office visit, a consultation, or a referral. Whether the patient is a new patient or an established patient. I think we can all agree a new patient will take more time to evaluate than a patient who is established with the physician. Remember that procedure codes correspond with charges. Therefore, codes for new patients typically are tied to higher fees than established patients. Reading directly from the introductory pages of this section of the CPT manual, it states, a new patient is one who has not received any professional services from the physician or qualified healthcare professional or another physician, qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice within the past 3 years. An established patient is one who has received professional services from the physician, qualified healthcare professional, or another physician, a qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice within the past 3 years. The next consideration for assigning the correct evaluation and management code includes the extent of history taken between the provider and the patient through questions and answers, and for the extent of physical examination done during the visit. For example, the extent of history taken and physical exam performed for a patient seen in a family practice clinic for an earache would not be as involved as a patient evaluated in a neurology clinic with progressive numbness and tingling of the legs. The 4 history and physical examination categories include problem-focused, expanded problem-focused, detailed, and comprehensive. These are further described in the textbook, so be sure to look at these categories. The coder also looks at the medical documentation to decide on the extent of physical examination that was done during the visit, as well as the decision-making necessary to determine a diagnosis and a plan. Again, taking the example of an earache versus a neurological numbness and tingling, likely the extent of examination and decision making would be very different, right? There are 4 categories for determining the complexity of decision making, which include straightforward, low complexity, moderate complexity, and high complexity. All of the above described components are taken into consideration to determine the service level that can be coded. Information must be accurately documented in the medical record in order to code a specific service level. Again, read more about this in the textbook. The nature of the patient's problem, and the time a provider spends with the patient can further support the selection of the correct evaluation and management code. Let's assign an evaluation and management code for our example of a patient coming to the office with an earache. The above information is noted in the clinic note for this visit. Office visit for a patient with otitis media, problem-focused history and exam with straightforward decision-making. Note that some medical documentation does not spell out the levels of history and examination as well as this one does. Many times coders must abstract this information from different sections of a note to determine these categories. If we look up the main information in the index, remember we start in the index, what do you think we should look up to start the coding process? Well, the service we are coding is the office visit, correct? Let's start by looking up office in the alphabetic index in the back of the CPT manual. Stop the video and find office in the index. Since our example is for an established patient, we can jot down on a scrap piece of paper the code range of 99211 through 99215, right? Now let's go to the evaluation and management section of the CPT. Remember, this section is the first section of the manual. Use the numbers on the sidebar and the guide numbers across the top of the pages to find where the code range begins at 99211. There are 5 choices for codes for an office visit for an established patient. Read the code information to determine which code supports the documentation in our example. The correct code for this example is 99212, office visit for an established patient with a problem-focused history, problem-focused exam, and straightforward decision-making, right? Code 99212 would be entered on the claim form. Here's a second example to try together. This new patient presents to the neurology clinic for consultation, referred by Dr. Johnson. She has had progressive numbness and tingling of the lower extremities for 3 weeks. A comprehensive history and a comprehensive physical exam took place. I spent 60 minutes with the family discussing my observations, possible diagnoses, and plan to further investigate the cause of the numbness and tingling. What should we look up in the index to assign a code to this visit? This is a consultation, correct? Let's look up consultation in the index of the CPT book. Again, use the guide words across the top of the pages of the index to find consultation. This is an office visit, so the code range is 99241 to 99245. Note for consultations, the codes are the same for new and established patients. Now let's go to the evaluation and management section and start with the first code, 99241, and read through the choices. Abstract the specific information necessary to make a determination. What code do you think is the correct code? Pause the video, search the information, and then start the video again for the answer. 99244 is the correct code for this neurology clinic visit. Note that documentation explaining 60 minutes was spent with the family helps support this code. 99244 would be entered on a claim form, and a corresponding charge for this code would be populated. As a quick additional note, most claims will contain more than one CPT code. Each procedure or service is coded separately. Consider the numerous CPT codes that might be included for an inpatient hospitalization. Thanks for joining me for this introduction to the CPT coding manual. I hope it has provided you some information to get you ready to assign codes to services and procedures. Have a great week, everyone.